Your body makes a hormone called GLP-1. This hormone tells your brain to feel full when you are eating. The medication, liraglutide, acts on this hormone. Therefore, when you are taking this medication, you will feel fuller faster and stay full longer. You'll likely eat smaller meals, have fewer cravings, and snack less. The hormone GLP-1 also works on the stomach to delay gastric emptying. Gastric emptying is the time it takes for the foods you eat to move from your stomach to your intestine. When taking this medication, foods will sit in your stomach longer than usual. This will also contribute to feeling of fullness. While on this medication, it's important to plan to eat smaller meals and to eat slower so that you don't eat too much. If you eat too much, it could increase the risk of side effects like nausea and vomiting. The amount of weight you may lose is unique to you and your body. Studies show that the average amount of weight loss is about 10% of one's body weight. This means a person who weighs 300 pounds would expect to lose about 30 pounds. A person who weighs 250 pounds would expect to lose about 25 pounds. It will take about a year to see the highest amount of weight you can expect to lose. This is an average, so some people may lose more weight and some people may lose less weight. This medication is taken once daily. There are 5 different doses of this medication. Each dose is given for 1 week before stepping up to the next dose. The goal is to get to the 3 milligram maintenance dose. If you have side effects, the dosing schedule can be extended. You will start with the 0.6 milligram dose once daily for 1 week, then 1.2 milligrams once daily for 1 week, then 1.8 milligrams once daily for 1 week, then 2.4 milligrams once daily for 1 week, and finally the 3 milligram maintenance dose once daily. The most common side effects of this medication are gastrointestinal in nature. They include nausea, vomiting, diarrhea, constipation, and indigestion. If you experience these side effects, reach out to your weight management provider. There may be ways to help minimize or prevent these side effects. Keep track of your progress. People who track their progress lose more weight than those who don't. Keep in mind that on average, you may lose 1 to 2 pounds each week. The best time to weigh yourself at home is first thing in the morning after you've peed and without wearing any clothes. Keep a weight journal and share results with your weight management provider. Reach out to your weight management team if you miss any doses. Depending on how long you have been off the medication, the dose you restart at may be lower. This medication is not considered safe during pregnancy or breastfeeding. For patients who can become pregnant, use birth control or contraception, and stop using the medication if you become pregnant.
Saxenda is a once-daily medication that can be taken any time of day with or without a meal. Your pen should be kept in the fridge until you're due for your dose. Because cold medication can be a little more painful to inject, you can take the pen out of the fridge about an hour before your dose. This will allow the pen to warm up to room temperature. Before you administer the medication, you need to ensure you have the supplies you need readily available. You will need the pen, the needle, and an alcohol wipe. Make sure your area is clean, you've washed your hands with soap and water, and sanitize the area you plan to inject with the alcohol wipe. This could be the belly, outer arm, or thigh. Wait for the alcohol to dry before injecting. Before using the medication, take a look at the medication window, which should be clear. If it is not clear or you see any particles floating around, do not use the pen. If it is clear, pick up your needle and remove the paper cover. Insert and screw this side into the pen like so. Remove the outer cap and save it for later. Remove the inner cap and throw that away. Up here, you will see the dose dial and dose counter. When you are about to use a new pen for the first time, it's important to prime it by twisting the dose dial to the dotted line. Press down on the dose button. You should see some drops come out of the needle. If you do not, repeat the process until you do see some drops of medication. Now that you're ready to use the pen, twist the dial to your prescribed dose, which could be 0.6, 1.2, 1.8, 2.4, or 3 milligrams. Once you have dialed the dose, insert the needle into the skin at a 90-degree angle. Press down on the dose button until the dose count goes down to 0. Keep the pen in place for an additional 6 seconds, and then remove it. If you see any clear liquid coming out of the skin, you may not have kept the pen in place for long enough, and could mean you did not receive the full dose. At that point, you would want to reach out to your weight management team. Now retrieve the outer needle cap that you set aside earlier, and recap the needle. Twist the needle off and throw this away in the shop's container, or a thick laundry detergent bottle. Check your state's regulations for instructions on how to best dispose of needles. Make sure you recap your pen and place it back in the fridge, or you can also keep it out at room temperature for up to 30 days.